Pyramiding is something we hear a lot from veterans, and it's something that VA uses often to deny veterans' claims. Veterans will often hear something like, you cannot be compensated twice for the same symptoms. And that's where the explanation stops. There's no further explanation. Oftentimes, pyramiding is described in rating decisions. You can tell it's been copied and pasted into the rating decision. There's not a lot of rationale or elaboration that VA does to explain what it is and the nuances of it. And so it's important to understand the concept of pyramiding. It does have very real implications for how VA decides veterans' claims, but oftentimes there's more to it. And so the actual regulation is more precise. I think it's important that we take a look at that here to set the context for our discussion. It can be found in 38 CFR section 4.14. VA says that evaluation of the same disability under various diagnoses is to be avoided. In plain English, that just means that VA can't compensate the same manifestation, meaning the same symptom or functional impairment, more than once. But that does not mean that a veteran can't receive separate ratings for related and separate conditions. And that's oftentimes where VA gets tripped up.
Yeah. So I think the easiest way to think about this is to look at how, like you said, the manifestation. So how do these disabilities actually affect you, or what functional limitations are you actually seeing from these disabilities? And are they separate and distinct enough to be rated separately? So, for example, if you have two different eye conditions that both cause blindness, you're only going to get rated for the blindness once because it's the same result. So what's the result? Are there two separate results? Do you have, I don't know, an eye condition that causes problems with seeing light, and then another eye condition that causes problems with seeing in the dark? I'm just making things up at this point, but that's two different symptoms. But complete blindness, one symptom, it's all going to be rated the same. So really what you're looking at is, are the symptoms separate and distinct?
Yeah, that's a great way of thinking about it. And another common example that we see involves spinal conditions and radiculopathy. Spinal conditions are oftentimes seen in veterans' cases. They involve either an accident or some injury to the veteran's back, and that results in the spinal condition, which is then rated under VA's diagnostic code as based on limitation of motion. And so the veteran will receive a rating for any limitation to motion based on their spinal cord injury, but the spinal cord injury will also oftentimes result in radiculopathy, which is a tingling or weakness sensation in the veteran's extremities, limbs, arms, legs. That's a separate and distinct condition, even though it resulted from the back condition. And so in that example, yes, the veteran can be rated for his or her spine, but VA should not attempt to use the concept of pyramiding to deny a separate rating for the resulting radiculopathy. Separate and distinct conditions, each can be rated separately to help a veteran increase their overall combined rating.
Yeah. Another example, let's take mental health conditions and sleep disorders. So mental health conditions, we're also seeing some overlap with sleep disorders because they frequently do involve a certain level of insomnia. And our mental health rating criteria does contemplate sleep impairment. But not all sleep disorders end with just insomnia or whatever the sleep impairment is that's also rated by the mental health disorder. Some sleep disorders, such as sleep apnea, also include difficulty with actually taking in oxygen. So that's a separate and distinct symptom. It's a physiological symptom versus a psychological symptom. Those would be rated separately. A mental health disorder that rates someone's difficulty sleeping, and then also sleep apnea that would compensate for someone's inability to take in air, or use of requiring a CPAP machine, for example. Two different conditions resulting in separate and distinct symptoms rated separately.
We also see issues involving traumatic brain injuries or TBIs and resulting migraines. Just as we were discussing before, TBI and migraines, they are separate and distinct conditions, despite the fact that they may all result from the same initial head injury. And so as a result, VA should be rating them separately. They each have their own diagnostic code that contemplates different functional impairments, going back to what you were talking about a little bit before. For example, TBIs are rated under section 4.124A diagnostic code 8045, and migraines are rated under diagnostic code 8100. And so each has its own diagnostic code, which allows for separate ratings, again, despite the fact that, maybe they both resulted from the same head injury in service, or that even the migraines resulted later from the TBI. And so, any attempt that VA may make to group those together and rate the condition as a single condition is essentially depriving the veteran of the benefit of having two separate conditions rated separately. And that's something you want to look for, appeal if necessary, but certainly call VA out on it.
Yeah, absolutely. I'm glad that you brought up that example because it's a good one. Both have they seem like similar conditions, or they're very similar in that they're impacting the head. But they're resulting in different symptoms, which is the point of pyramiding. And we want to make sure that each symptom that, somebody has its own box. So the cognitive impairments that we see related to a TBI, they have their own box. Those symptoms should be rated. And then we also have people with very severe migraines. They might not be able to function when they're in a migraine. That's a separate symptom that needs its own box that needs to be rated. So even if they're from the same occurrence, they happen from the same accident, they both have to do with the head. What we're looking at is the symptoms, not just the conditions themselves.
So to recap this segment, if a claim is denied based on pyramiding, a veteran should really look at three different things. Mm-hmm. The first is whether the symptoms are actually identical, therefore invoking properly the pyramiding statute, or whether they're just simply related, going back to the TBI, the migraine example. The second is, do the conditions have separate diagnostic codes and separate rating criteria? If there's separate diagnostic codes and separate rating criteria for the two conditions, it's likely that veterans can get separately rated for each condition, and VA, if they combine them into one, is doing so improperly. And the third is analyze the functional impairment caused by each condition individually. Again, if there's overlapping functional impairment, that's where you might run into issues with pyramiding. But oftentimes, the conditions will have separate and distinct functionality or impacts on functionality, and those impacts should be rated somewhere in VA's diagnostic criteria to compensate the veteran for the full array of all their symptoms deriving from those different conditions. Mm-hmm. Given how technical and complex pyramiding can be, don't be afraid to reach out and ask for help. If you would like more information on any of these topics or other topics, please feel free to reach out and take a look on our website.